2 days of oatmeal consumption to reduce cholesterol levels. Yes, it was actually that simple, although the effects were quite astounding. Not just the drop in cholesterol levels after 2 days, but also, and of course the simplicity, the length of time those benefits were maintained. Now keep in mind, we're talking about impacting the microbiome, not just the consumption of per se of fiber. In this case, the oats, high in beta-glucan, which resulted in ferulic acid. Ferulic acid then resulted in episiplotrichoacei, UCG 3.0, which then produced dehydroferulic acid, and in short, the hydroferulic acid did its magic by mitigating the impact of elevated cholesterol. So, in that flowcharted sense, it was quite spectacular. But let's get into the simplicity of it. Again, in the beginning, I always go to the layman aspect, and then towards the end, towards the researcher and healthcare perspective, and also study protocols. So in the study itself, again, also too, before I go too far into it, this was based upon research that was conducted in 1907, or I should say published in 1907, basically titled the Oat Cure, in which they used 2-day intensive oat consumption to basically improve those under at that time diabetes or metabolic syndrome challenged. To proceed as follows. A short-term based diet appears to be surprisingly effective at reducing the cholesterol level. This is indicated by a trial by the University of Bonn, which is now published in the journal Nature Communications. The participants suffered from metabolic syndrome, a combination of high body weight, high blood pressure, and elevated blood glucose and blood lipid levels. They consumed a caloric-reduced diet. Again, this is a randomized controlled trial. It consisting almost exclusively of oatmeal for 2 days. Their cholesterol levels then improved significantly compared to the control group, which consumed pretty much the same spectrum, minus the beta-glucans in the oat-consuming group, per se. Even after 6 weeks, the effects remained stable. The diet apparently influenced the composition of microorganisms in the gut. The metabolic products produced by the microbiome appear to contribute significantly to the positive effects of the oats. Again, when I say beta-glucan, we're still postulating. But to proceed as follows, the benefits were observed. The oat cure returns. There's a little bit in regard to the doctor and when they did this back then and why they saw these observational benefits and worked, and basically I should say acted upon those benefits through this oat consumed diet. Now, to measure many years later, over a century, there we have the 2-day drop. You're looking about basically a 10% reduction after 2 days. Again, not necessarily because of the fiber, even though I'm a big fan of fiber, but because of the composition of the oats itself. Again, it is that dehydroferulic acid, that end byproduct from the oat consumption, which appears to yield that tremendously beneficial outcome. To proceed, not just the fiber, there's that fuel, the erysipelotrichoacei in the middle of the factory, so ferulic acid, erysipelotrichoacei, UCG-003, and then what they call the outcome or the machine, the dehydroferulic acid, which then keeps the cholesterol levels in a better range. Again, and also too, some of the blood markers were 15 times higher in beneficial impact. Some of the blood markers were 15 times higher in the group consuming the oats just after 2 days, the beneficial ones per se. All right, there's a 6-week bonus. Check that out. Just 2 days. The benefits still carried itself over. Again, we're talking, think of it like gardening, where you're basically increasing the beneficial bacteria of the gut. And it just doesn't go away like a drug or some sort of medicine per se that you take on a daily basis. This is like, boom, microbiome improves, that garden's going, and you're producing dehydroferulic acid through this complex method per se, and there you have it. It mitigates the impact of those rises of cholesterol levels and other metabolic markers. Now, back in 1907, they used it for a lot more, but we don't want to interject publisher bias. We don't work just with the study outcome and worry about secondary outcomes later on. The preparation, though, for those looking to do this at home or the care of a healthcare professional, does matter. Don't boil those oats. You simmer them and soak. Real important because you don't want to destroy those phenol compounds, which are responsible for feeding all the good stuff. And the risotto, that's kind of cute. That's just an example of a recipe using the oats. All right, there's your resets. There's, for example, the study protocols per se. Their diet what else it consisted of, as far as the control being very similar to that for the 2-day period. Now, the longer doses, a little different. Benefits per se, only 80 grams per day, as opposed to 300 grams of oats per day, but still benefits were just the same. Now, that is pretty amazing overall. So to conclude with the general aspect, in conclusion, oat consumption, particularly a short-term high-dose oat diet, provides metabolic health benefits for individuals with metabolic syndrome by increasing circulating microbially produced phenolic metabolites, thereby lowering serum cholesterol levels. This identified mechanism shows that phenolic metabolites, besides short-chain fatty acids, are driving factors for the cholesterol-lowering properties of oats, and emphasizes that the interactions between oats and the gut microbiome play an important role in the health-promoting effect. All right, let's get right into the scientific breakdown. Again, it says the oat cure. We're not prescribing or diagnosing. We're just working with the title of the treatment back about 100 years ago or so. All right, so there you have it. You look at the combination there, the LDL total cholesterol. I put the translations up there as well for those that want to follow along in the research aspect. But when you look at this, when the microbial advancements over the past 5 years, our understanding, have been on pace pretty much with computer science. I mean, it's kind of like going from Fortran to Python in 5 years. In this case, we are really beginning to understand the polyphenols and the microbiome community with a much greater appreciation in the past 5 years than any other time before in a technical aspect. Observationally, we kind of knew with fermented foods and things like that. Now, it's a whole different ball game. Now we're breaking it down into data. There's the metabolic microbial data, and there's your erysiperotrichosis, UCG 003. And there you have your breakdown. Now check this out. Look at the 2-day aspect. The dehydrofluoric acid in the bottom corner there. That is pretty amazing overall. All right, your clinical advisory breakdown. The benefits, long-lasting, as you could see, and the reproducibility and critical analysis. It's kind of tough to do complete blinding when you're dealing with oats and so on and so forth. But what a wonderful, simple study for any research institution to initiate, because it's only 2 days and you can do it in vivo, real simple. Piece of cake. Still expensive, but piece of cake. And real important about do not boil, because you can destroy the phenol compounds. And as far as also to how they broke it down into 3 meals per day and so on and so forth. Again, pretty amazing. Gratitude to the researchers for basically bringing to light and explaining something from an observational standpoint that worked quite a while ago. Why would it not work today? And guess what? It appears like it does, without any publisher bias. I am humbled you watch, and look forward to see what you and I both discover again next week. Catch you all next time. See you then. Bye.